Let's begin. So, what I'm going to be talking about, again, as I've already mentioned, is the 2024-2025 measles outbreak and what's been occurring. I'm going to be touching upon just some of the key points. So, I'm going to be talking about what is measles, the symptomology of measles, what the symptoms look when we have measles. I'm going to discuss measles management and prevention. So that's going to be along the lines of vaccination, how to prevent yourself from getting measles. Again, measles is highly infectious, highly infectious, where if you're not vaccinated or not properly vaccinated, we're talking about 90% of the people who are exposed will get it. So highly infectious. And I'm going to mention something which is going to come up later on. It's also airborne. We're going to talk about what are the requirements for measles vaccine, which is going to be a nice chunk. I'm going to will probably be repetitive in that regard, just to drive home the point as well. And I'm going to touch just briefly on the 2024-2025 Public Health Ontario and Health Canada measles outbreak updates, what's been happening over the last little while. And again, as I said at the end, I'm going to leave time for some questions and answers. If you have any questions, by all means, ask away. And if you're just shy and don't want to come and ask questions here, by all means, uh, reach out to me via email or even call me if you'd like to as well. I'm always open. I'm around 24 hours a day, so feel free to reach out to me. So, what
Wait.
what
Yeah.
is measles? Am I clear? Can everyone hear me, first of all?
Yeah, we can hear you, Dale.
Perfect, perfect. So, what is measles? So, measles is a very highly contagious virus. They're spread through respiratory droplet and airborne. Virus can live on surfaces and in the air for up to 2 hours. And again, as I mentioned, 90% of non-immune individuals will become infected after exposure. So, whenever I always like to say we talk a lot about precautions, routine practices, and precautions as well. We talk about airborne droplet precautions. We talk about contact precautions. We also talk about airborne, but very little do we ever have to deal with airborne precautions. Typically, whenever I talk about airborne precautions, even in the hospitals when I worked there, only time we saw anything of this sort or ever had to deal with airborne precautions is when we had to deal with primarily measles or tuberculosis, which are highly infectious diseases. Measles is very highly infectious in that whenever you're dealing with anyone who's been exposed to it or who is positive or is a case or even a probable case, you have to ensure that you have all the proper protocols of PCR is being done, point care risk assessment's been established, and we know the person is either probable or confirmed, and we wear the prescribed PPEs to keep ourselves safe in that regard. So again, highly infectious.
You
Some
busy
of
on the
this
weekend? Wanna go to your hotel?
some of the symptoms that we do deal with are early signs. So early symptoms usually typically happen around 7 to 21 days post last exposure. Um, so if I'm exposed today, I'm around somebody who had positive for measles, I will typically show symptoms within 7 to 21 days after my exposure today. And there's times where you do wait up to 21 days before these symptoms start to rear their ugly head. Some of the symptoms that we tend to note are very high fever, which is very dangerous. We see cough. We see a lot of runny nose, red and watery eyes. Another big one when I've worked in many public health units as a communicable diseases investigator, and we used to see a lot of symptoms with people with Koplik spots. So tiny little spots inside their mouth, kind of like the photo that I have up in this on the screen as well. So tiny little spots, which we call Koplik spots, and the progression would be to a rash, which would start on the face and disseminating downwards or spreading downwards throughout the rest of the body as well. So that rash is very unique to measles. Mind you, also do get rashes when you have other diseases such as rubella as well, which is considered German measles or a form of German measles, which is 3-day measles, is what they like to call it. But with measles, the rash is very prevalent, starting from the face and spreading downwards as well. Some of the complications that you'll see with measles are ear infections, diarrhea, pneumonia, and a rare fatal brain disease as well, SSPA, which I won't get into. It's a very long word. I won't get into that, but it's very rare but fatal brain disease as well, which is also attributed with measles. So one of the reasons why we put a lot of emphasis on prevention with measles is it's very dangerous, very uncomfortable, and in some cases can also cause death or severe illness. Incubation period. So measles has an incubation period or a period of communicability. So the incubation period is a period of time from exposure to onset to the first symptoms. So it's usually 7 days post first exposure to 21 days post last exposure. And the time during which someone can transmit infection is usually 4 days before until 4 days after the first day of the appearance of the rash. So typically, and it mimics many other diseases. When I say mimics, kind of like COVID, where you're infectious prior to symptoms. The same thing with measles. You will be infectious prior, so 4 days before that rash, to as long as 4 days after the appearance of the rash. So this is usually an indication. If the fever is around too, is usually an indication that something is brewing, and that usually also establishes a point of care for in terms of exposure as well. So be very precautious when someone has a rash. Do understand that there's a slightly likelihood that it could be positive with measles. So you have to take all precautions or airborne precautions to protect yourself and those around you as well. So we're getting to prevention, which is the most important part of it for measles. So prevention's primary method is vaccination. And the vaccines that are available for this are the MMR, which is the measles, mumps, and rubella vaccine, as well as MMRV, which is the measles, mumps, rubella, and varicella, which is chickenpox vaccine as well. It's very effective in that the first dose is usually around 95% effective, and then with the second dose, you're getting about 99% effectivity as well. However, we do have noted that over the last little while, people that have just had one dose alone, their titer tends to be fairly low depending on when you had it. And that is one of the reasons why we're highly recommending that those who've only had one dose to get a second dose for protection, and especially those who are in healthcare facilities or work in healthcare. It is mandatory that you do have a second dose for protection. And that's all based on the age that you were born as well, which we will get into a little bit later on in the presentation. So again, primary method for prevention for COVID, for measles is vaccination, and trying to ensure that you have all two doses is very, very important as well. So I'm just going to ask a quick question. I like to throw questions out at everybody just to see if everyone's awake still and I haven't bored, they're not bored of my presentation. I have a quick question I'd like to ask everyone and my first question is measles airborne, true or false? All right. I think we got pretty much everybody here. And the answer to that is true. It is airborne. It is also airborne droplets as well. So primarily airborne. Typically, if you were to go into a room where someone was positive with measles, there's a very strong likelihood that if that person left that room, for instance, say 2 hours prior to you entering that room, there's a very strong likelihood that you could still be infected with measles. And the reason for that is the virus is very small in terms of micron size. And as that room goes through its filtration, when I say filtration, the concept of recirculating air in that room, it takes a lot of time. And in some cases, depending on the type of filtration unit that's being used, it may take hours before it's actually out of that room. So if a person was in a room who was positive with measles because it's airborne, because of the size of the airborne, the microns or the size of the micron of that of measles virus, you stand a very strong likelihood as well of being exposed and being infected with it as well. So the right answer is true. It is airborne. So let's talk about vaccination recommendations. So just general vaccination recommendations is children. First dose is usually given at 12 months of age. Second dose is usually given at 18 months or 4 years of age as well. And the reason why we have this here is because generally kids are the ones that are highly affected by measles, as well as adults, don't get me wrong, but kids tend to get it fairly easily as well. And a lot of it is based on their lack of immunization or vaccination status. Travelers, infants 6 to 11 months, early dose recommended before an international travel, and adults born before 1970 generally are immune. And that's under the assumption that they've been infected or been exposed sometimes in their youth, and that they have the antibodies for that. Whether or not that's always true all the time, that isn't always the case. I know with healthcare workers, it is still mandatory in many cases that we are vaccinated and that you have those two vaccines for measles as well. And those born 1970 or later, two documented doses are required. So again, born 1970 or later, two documented doses are required. But if you're born before 1970, it's generally assumed that you've been exposed and that you have antibodies for measles as well. In many cases, if you're under the impression or you aren't too sure whether or not you have any form of protection for or immunity for measles, a good idea is just to go into your doctor in many cases and do a simple blood test. They'll test for measles, and if the IgG is positive, that's usually an indication that you have some form of antibodies for it as well. They'll let you know whether or not you're immune to it. Very easy to do as well. Adult vaccination guidance. So, if only one dose or no doses, one documented dose, it is required to get the second dose as soon as possible. And the reason for that is because you just had one documented dose, and we're unsure whether or not you've been vaccinated for the second time. It's a good idea to get that second dose for protection because typically the first dose, as much as it is very effective, many a times our titer tends to dwindle, and when that dwindles, that leaves us compromised to measles. So second dose is usually required or recommended. No vaccination records at all. Get the two doses at least 28 days apart as well. And again, that's the whole reason behind it is vaccination protocol. Get first dose on one day. The second dose should be done at 28 days apart. And we do have special groups that are either required, it's mandatory that they are vaccinated or that they don't get it based on pregnancy. So healthcare workers, two doses are mandatory. International travelers, two doses are mandatory as well, are highly recommended. Of lately, we have been noting that a lot of new cases have been getting it from travel as well. I don't know if everyone knows this. I'm an airline pilot as well. I've flown for Air Canada. I fly big jets. Typically, as a pilot, we do have air that comes into the airplane from outside to keep the plane pressurized, but under many circumstances, the air is filtered through something called a PCU unit that comes right around and goes back into the cabin. So a lot of times, if someone is positive with any type of respiratory, any infectious disease, for instance, measles, which is highly infectious, you will get it in the aircraft. Very unlikely that it will filter that out and that air will be recirculated. So if you are traveling, you're flying out somewhere, going anywhere on vacation, I would highly recommend that you ensure that one or two things that you have the second dose, or that you know your immunity or your status as well, whether or not you're immune to measles. Pregnant women, vaccination deferred until postpartum. And if you're immunocompromised, we ask that you consult your healthcare provider to ensure that everything's okay with you traveling or doing anything else. If you're immunocompromised, whether or not you can support getting the vaccine as well. So these are some of the recommendations that have come down from public health from the ministry and from the Health Canada, Public Health Agency of Canada as well. So, measles in Canada as of April 25th, 2025. So we had roughly 1,069 confirmed, Ontario, probable cases across 7 provinces. The major outbreak, again, as I said, was linked to an October 2024 international traveler, and that was in New Brunswick. Most cases are in unvaccinated communities. So we do have And without mentioning the community, we do have a community that it is unvaccinated. If you check the Public Health or Public Health Agency of Canada website, it does go into talking about the Mennonite community not being under vaccinated, and there tends to be a massive or a surge amount of cases within southwestern Ontario based on the community being under vaccinated as well. It's a good read, and it kind of outlines. And as you look at the areas where the massive numbers have been seen, you will see a lot of it in the southwestern public health units within Ontario and in Canada as well. And you tend to see that those numbers are very high in those unvaccinated communities as well. And travel-related cases in BC as well. So we did have some travel-related cases, one in New Brunswick and in BC as well, which helped to spur on this measles outbreak too. Focusing on Ontario, we had, and this number has changed. I just saw it recently again. It's a little higher than this, over 1,020 cases reported as of April 24th, 2025. 75% of these cases are in children and in teenagers, again, because of low vaccination rates. Southwestern Ontario was the most affected area, and again, based on this community of under-vaccinated population, we saw a massive increase in numbers positive measles cases as well. And this is also due to low immunization rates of less than 70%. And for us to have some form of herd protection within the community or within the province or within Canada, we need a herd immunity of at least 92.5% of those having being fully vaccinated or having immunity before we have any form of herd immunity within our population as well. Because the numbers are very low in terms of completed immunization status, this is one of the reasons why we're seeing such an influx or such an increase of measles cases within the province or within the country as well. Now, what to do if you're exposed? This is a popular one, and I've worked in again, I worked in Toronto, Guelph, Niagara Falls Health, Peter. I've worked in many public health departments as a communicable diseases investigator, and as well as a manager downtown at a couple of hospitals. And this is a big concern, especially in the hospitals. If you are exposed and if you are protected against measles, it's very unlikely that you will develop disease as precautionary measures of measles symptoms. So symptoms until 21 days after the date of exposure. People are usually considered protected if they have at least one of the following. So there has to be proof of vaccination with 2 valid doses of measles containing vaccine. So it's the MMR vaccine. And again, I said you have to have one of the following: blood work showing antibodies to the measles. So you have to show antibodies in a very simple blood test. They take some blood, they test your IgG, IgM. If you're IgG positive or reactive, I should say, you have some form of immunity, or documentation of prior laboratory confirmed measles infection. Another one is are born before 1970, with the exception of healthcare workers, where it's mandatory if you're a healthcare worker that you have the 2 vaccines. All healthcare workers require evidence of vaccination with 2 valid doses of measles containing vaccine or blood work suggestive of immunity. So again, as I said, measles, IgG, reactive, regardless of the year of birth. And if you don't have any of the above, you are not protected against measles. So we're not considering you to be protected against measles. And what I wanted to say when I talked about this in the beginning, and I talked about working in public health and in the hospitals, is one of the biggest things is if, and I'm sure I'm going to get into this in eventually in my other slide, but I'll say it here. If you're under the impression or under the concern that you've been exposed to measles or you have any symptoms that are indicative or in line with a measles infection, what we typically ask that you do is if you need to go to the hospital or if you need to go to your general practitioner to get tested or for any form of confirmation or confirmatory test, we ask that you call ahead and let them know. The reason for that is because measles is so highly infectious. If you walk in there thinking that you are positive and you have any symptoms, the rash, the fever, showing that you have measles, and you now go in there without wearing proper protection, proper mask, N95, medical mask, and you walk into the hospital, you've now exposed everybody in there as well. I'll probably get into that a little bit more as we move through the slides as well. Exposure recommendations. If you think, here we go. If you think you've been exposed and you're not protected against measles, or if you're unsure about your immunization history, sorry, if you attend or work at a school if you attend or work at a school, childcare, or healthcare setting, you must stay home and contact your local public health unit for further direction. So if you or any of your family members feel that you've been exposed at work, at home, or ill, the best thing to do, contact your doctor, contact the hospital, but also contact the local public health unit. And what they're going to do, what the local public health unit's job is to do, is to call ahead to the hospital and notify them and let them know that we have a client or a patient or a resident who will be entering your facility at this specific time or on this date, and they will have or ensure that there are medical staff there waiting for you or give you some form of direction to ensure that you're not putting everybody at risk. So it's very important that you call ahead. If you've had no doses of MMR vaccine, stay at home and contact your local public health unit for further direction. If you had one dose of MMR vaccine, call your healthcare provider or local public health unit to receive any additional dose of MMR vaccine. Notify your healthcare provider of your exposure so they can take appropriate precautions to limit the spread of measles. Unless you work in a healthcare setting, you can immediately return to work, school, or daycare after you get a second dose of measles containing vaccine. So again, if you've only had one dose of MMR vaccine, call ahead and let them know that you've been exposed or that you need a second dose. Some cases, they may even give you immunoglobulin, which is a short-term fix. And what that is it's a blood plasma with antibodies or measles antibodies inside of it. And again, as I said, it's a very short fix way of prevention if you've been exposed to someone who's had measles as well. If you or a family member are at high risk of complications as listed below, contact your healthcare provider or local health unit to discuss options to reduce the risk of measles infection through vaccination or product, as I stated, called immunoglobulin. For these to be effective, they must be given very soon after exposure. So babies under 1 year age who have not received measles vaccine should get it. People with severe weakened immune systems or pregnant individuals who are not protected against measles. So again, immunoglobulin is a short-term effective way of prevention against measles and should be given, I believe it's within the I'm trying to go off of my recent study, 6 days within the last exposure. If you were exposed today, if you were exposed today, you have 6 days to receive that immunoglobulin. It may have changed recently, but I believe it's 6 days. And it's very important, and it also works as well as a preventative measure if you've been exposed to measles. Against exposure recommendations continued. If you're uncertain about your vaccination status, call your healthcare provider or local public health unit to determine if you've received an MMR vaccine in the past. And again, watch for onset of measles symptoms until 21 days after date of exposure. So there's a list of places and dates of possible exposures to cases of measles on Public Health Agency of Canada website and Health Canada website and on Public Health Ontario website as well has it, where you can determine whether or not you're truly exposed to measles at specific sites. It's pretty large, and it's a good read if you have any fears that you may have been exposed at all. If you develop symptoms and need medical care, call ahead before you visit the doctor, as I stated, or clinic or hospital to inform them that your exposure to measles so they can prepare for your arrival and take all their appropriate precautions. And the reason, again, for this is measles is highly infectious, highly infectious. So it's good that you call ahead. And if you develop symptoms and do not need medical care, call your local public health unit. So if you do develop symptoms and don't need the medical care, call a local health department just to notify them, because we do capture this information and it helps us to understand and say, okay, where is your exposure. We can delineate and kind of confirm exposure areas as well. And it's also for numbers as well, for statistical value as well at the end of the day. So it's great to call your public health unit ahead, let them know what's happening, if you need medical care or if you don't need medical care as well. So I'm just going to kind of run through this. It's just high-level measles key updates. So some Mennonite communities are being significantly affected by the measles outbreaks, as I stated, because of under vaccination. 90% of people who do come into contact with measles virus will become infected if they don't have immunity from vaccination or previous infections. Pregnant women, babies, and children under 5 years of age and people with weakened immune systems are at risk of severe health complications if they get measles. Sometimes people can die as well. And that's why we're putting a lot of strength and emphasis on this from the public health level. If you interacted with someone with measles or your household attended or your household attended a gathering such as a wedding, church services where measles was circulating, it's best to limit your contact with others and monitor for symptoms for the next 3 weeks or 21 days. If you or someone in their household has measles symptoms such as fevers, cough, runny nose, red watery eyes, and the rash, keep everyone in the household at home. So if anyone in the household has any symptoms that's indicative to measles, we ask that you keep everyone in the household at home, away from others to prevent the spread of your neighbors and to other communities, and also call ahead to public health, notify them what's happening, and have them notify the hospital or your GP to get tested to verify whether or not you do have it. We do ask that you seek emergency medical attention if severe symptoms do develop, including difficulty breathing, confusion, difficulty waking up, or decreased urination or lack of tears. Before arriving, as we stated numerous times, I'll say it again, notify the hospital or clinic that you're bringing someone who may have measles. This will allow the staff to take appropriate actions and to protect themselves and other patients from the measles virus as well. And you can choose to be vaccinated against measles to protect yourself and your family. This will be also contribute to the health and safety of your whole community. So if you have not received it, you've never received the vaccine, and you're not exposed, but you think you should get it, it's a great idea to get it because it will protect you from getting the measles later on down the road as well. And in current situation in Ontario, as I stated, we said April 24th, 2025, we had roughly 1,020 measles cases in the province. We said demographics, approximately 75% of those are among infants, children, and teenagers. And geographic spread, the majority of cases are concentrated in southwestern Ontario, particularly in rural areas served by Southwestern Public Health, including St. Thomas, Elgin County, and Oxford County. And again, because of the demographics and the population that they serve, that's the reason why they've seen such a high influx in new measles cases as well. And again, reiterating what I said earlier on, factors contributing to the outbreak were vaccination rates were fairly low. Ontario's immunization rates have averaged about 70% in recent years, below the 95% threshold required and needed to maintain some form of herd immunity. Unvaccinated populations, as I said in the previous slide, in Southwestern Public Health District, 92.5% of pediatric cases and 62% of adult cases were among unvaccinated individuals. So as you can see, the reason for the influx or increase in cases is because of the numbers of unvaccinated measles, population of vaccinated cases as well. And what the public health responses are? Our public health responses are vaccination campaigns. So public health units are offering early dose of MMR vaccines for infants ages 6 to 11 months of age and second doses before age 4 in high-risk areas. What we're also doing exposure notifications. Authorities have identified exposure sites and are advising individuals who are present at these locations during specific time periods to contact their local public health units as well, just to update them, and travel advisors. Any residents are encouraged to ensure their vaccinations are up to date, especially before international travel. And again, as I stated, there has been a public health alert and advisory for Ontario and for even New York, where they've seen huge amounts or an increase in cases, and they've asked that anyone traveling in those areas to ensure that you're fully vaccinated prior to traveling to these areas as well. So protect yourself and get vaccinated. And again, ensure vaccinations, ensure your family members are fully vaccinated with 2 doses of MMR vaccine at all times. Stay informed, monitor updates from Public Health Ontario and your local health units for the latest information on exposure sites and vaccination clinics, and seek medical advice if you suspect exposure to measles or exhibit any kind of symptoms. Contact your healthcare provider promptly, but contact public health as soon as possible. And that is it. Thank you.